Hi, everyone. Welcome to this PSA series session. Thanks for coming. Today we're going to do the providing information session. And it's going to be me, Helena Vincentelli, and Dr. Nidhi Vedd presenting today.
Hey guys,
And
my name's Nidhi. I'm one of the F1s at Kingston.
I'm also an F1 at Kingston. Cool. Next slide, please. So we were supposed to have a BMA rep talk, but I think the BMA rep has not arrived. So we'll just skip through these slides. That's all right. Great. So this is a slide with our wonderful organizers, Soumya, Balamreet, Janice, Akash, and Sona, who's here with us. They've done all the hard work behind this series. They're amazing. And then just a quick disclaimer, this has been done by us on a voluntary basis. There might be mistakes. Please point them out if you see any, but we're doing our best. And so we don't, take responsibility for any unintentional inaccuracies. Cool. So these were the previous sessions, and then today we're session 7 on information giving, and then there'll be more sessions starting again in the new year. So so today we're going to cover providing information, and we're going to cover questions on all those different topics. So medicine, surgery, elderly care, peds, psych, obs and gynae, and GP. And we'll try to cover all of those medications that you can see on this table. Great, so these are the topics we're going to cover, and we'll start with medicine. Great, so we're going to do it, it's all question based. So this is the first question. We're going to have a poll open so that you guys can participate. Great, so question number 1. A 66-year-old man with type 2 diabetes is found to have poor glycemic control despite being on a single oral diabetic agent for over a year. Dapagliflozin is added to his treatment regime to help achieve better glycemic control. Select the most important item of information he should be given on starting this new drug. So if you guys can answer on the poll. I'll give it like 10 more seconds. I think we've got 1 response so far. Oh, 6. Great. I'll wait until there's over 10 responses. Okay. So let's show the answer. So the answer is A. Patients should be informed of the risk of DKA and its symptoms. The other answers are for other glycemic agents. So you can find this information. Essentially the answer to every question can be found in the BNF, since this is the PSA exam. So this is where you can find it for this specific medication. It's on the patient care advice section. And then if you go 1 more slide over, here's a little table that we've made for you guys that you can read later with the specific information for all the different diabetes medications that have like information that you would need to give to the patient when they're started on it. So dapagliflozin is an SGLT2 inhibitor, so they're at risk of DKA, including euglycemic DKA. So that's why that's the right answer, which most of you got. So good job. Next question. So case 2, a 74-year-old male presents to hospital complaining of tenderness in the temples and throbbing headache. He also describes a painful sensation over his scalp when brushing his hair. An elevated ESR was noted on investigation, and a temporal artery biopsy was positive for giant cell arteritis. He was commenced on prednisolone 40 milligrams daily. So select the most important side effect which the patient would have been informed about when commencing on prednisolone. So here are your 5 options. Let's start the poll for this one again. Great. And if anyone has any questions, feel free to pop them in the chat as we go along. Okay. And the answer is D, adrenal suppression, psychotic disorder, and increased risk of infection, which most of you got. Good job. And so where we can find this information is in the side effects part of whichever steroid drug they're on. You can look them up. They'll all have very similar side effects. The most important one to make sure to know is adrenal suppression, as that could be a medical emergency. So that we know for sure that that's the right answer because that's included in that one. Great. And third question in medicine, you are reviewing the medication of one of your patients, a 65-year-old man who has a past medical history, including ischemic heart disease, type 2 diabetes, and osteoarthritis. To which of his regular meds can he develop a rapid tolerance to? And we've got 5 options again. Okay, a couple of seconds. Okay, and the correct answer is B, isosorbide dinitrate. This is a bit of a tricky one because I can see that a good number of you put D, dihydrocodeine, and you can develop a tolerance to codeine, but what's specific about isosorbide dinitrate and all the nitrates in general is that you develop a rapid tolerance to them. So if we go to the next page, and it's very clearly stated on the BNF that you can develop such a fast tolerance to it that you need to take time off of it. And so they explain here in detail having to take time off of the medication. Great. Next section will be set by Nidhi.
Okay, so I'm going to take you through a couple of surgery cases. So the first one, a 40-year-old woman comes to the breast cancer clinic to discuss hormonal treatment for her HER2 positive breast cancer. Her past medical history includes polymyalgia, rheumatica, it was jointly decided that she should start tamoxifen 20 milligrams orally every day. What is the most important piece of information that should be given to the patient? So I'll give it about a minute for you guys to put your answers. Okay, I can see 4 responses so far. I'll give it a little bit longer. Okay, it doesn't look like we're getting more than 4. So the right answer is C, which is she should seek immediate help if she develops sudden shortness of breath. So if you look in Medicines Complete, there is a section about the effects on the endometrium and also a section about risk of thromboembolism. So it increases your risk of DVTs and PEs. So the one thing we'd worry about is the symptoms of shortness of breath or breathlessness, and then they can be investigated for a PE. There's also a section on the side effects, which lists some of the common ones. So cataracts is something that can happen, but that's not quite as important as a PE, which is more acute. And also, I think there was another option about diarrhea. Obviously, that's not an ideal thing, but it's not something that's super urgent. It might be just a common side effect or a slight intolerance. So I think most of you got that. So the next question, a 60-year-old man is admitted to hospital with fever and a 3-day history of lower urinary tract symptoms, so dysuria, urinary frequency, and difficulty urinating. He's diagnosed with acute prostatitis and started on ciprofloxacin 500 milligrams BD for 14 days. What's the most important piece of information that should be given to this patient? I'll give it 10 more seconds. Okay, so the correct answer is, which most of you got, is he should seek medical help if noticing ankle or calf pain, and this is because of the specific risk of tendon damage or tendinitis with ciprofloxacin. So there is a section in the BNF which explains tendon damage and the fact that they must seek medical help if they develop these symptoms. In terms of the other ones, so ciprofloxacin, just to note, it shouldn't be chewed, it just should be swallowed. Decreased appetite is a common side effect, but it's not as significant as explaining the risk of tendon damage or tendinitis. And there's no blood test monitoring for ciprofloxacin. And migraines are in the side effect profile, but they're under very rare or rare. So it wouldn't be something you need to bring up to the patient. Okay, I'm going to hand back to Helena.
Great, so we're going to do elderly care now. So first case is it showing? Oh, there we go. So 75-year-old with AF atrial fibrillation used to be on warfarin, but was switched to apixaban, a DOAC, during his last admission to hospital. He was referred to the anticoagulation clinic on discharge and given an information leaflet on DOACs. What is the most important item of information from these he should be aware of? And we've got 5 options. I'll give it 10 more seconds. Any last minute answers? Okay, so the answer is E. I think this was a bit of a tricky one. So essentially, so let's stay on the slide for a second. A, B, C, and D are all true for warfarin, and E is the only one that is true for DOACs, like apixaban, rivaroxaban, etc. So if we go to the next slide, I'll try to explain. So if we go, so DOAC stands for direct acting oral anticoagulants, and it includes the drugs that I mentioned, amongst others. They're listed there, and their patients are being switched from warfarin to DOACs because they're so much easier to use. So they don't have all of those lists of side effects which warfarin does have, or limitations which warfarin does have. But the one thing about DOACs is that they have a short half-life essentially, and the effect diminishes in 12 to 24 hours after the last dose. So if doses are missed, then the anticoagulant effect is lost quite quickly, which is a good thing if the patient has a bleed, but not a good thing if the patient's supposed to be taking the medication. So that's why E was the right answer for this. So I think it'd be worthwhile just looking at the warfarin side effects and the warfarin kind of limitations on the BNF, and make sure you know those to compare with DOAC. Great. So next question. Are there any questions about that warfarin question? No? Okay. So case 7, an 80-year-old lady presents to hospital with a fractured neck of femur. Over the past couple of years, she also had a fractured wrist. After her fracture is acutely managed, you start her on alendronic acid. What is the most important piece of information that should be given to the patient? We've got 5 options. They're a bit lengthy, so I'll give you plenty of time to read through them. Okay, 10 more seconds. Okay, great. So the correct answer is E. And this question's a bit the devil's in the detail. So the wrong answers are really similar to the right answer with just slight changes. And for bisphosphonates, there's a really specific way of taking them, and the patients really do need to be informed about how to take them. And the specific way of taking them is answer E. So if we go to the next page, it's word for word what is written on the BNF. So the patients have to take it swallowed whole while sitting or standing with plenty of water at least 30 minutes before having any food or any other medications, and they have to stay upright for at least 30 minutes after. And it's very specific, but this is how it is for all bisphosphonates, and it needs to be exactly like that. But 92% of you got this, so good job. Next question. Oh, it speeds. Back to Nidhi.
So these are a couple of cases that come under pediatrics. So a 16-year-old male is admitted to hospital with a first presentation of diabetic ketoacidosis. He subsequently diagnosed with type 1 diabetes and started on a basal bolus regime of insulin. Which of the following are the most important to discuss with him? So I'll give you about a minute. Okay. So this one's a little bit tricky, and I think I can see like a fairly even split between C and D. So technically they're both correct, but the thing with the PSA, it's about trying to figure out which one is the most important in terms of like making sure they're not going to be acutely unwell. So when someone is unwell, they have increased resistance to insulin. So the blood glucose increases and the body's more resistant. So you need higher levels of insulin in order to stop it progressing into a DKA, which is what you're really worried about. So the answer is he needs to take his insulin even if he's not eating. Some sources might say also increase the level of insulin, but it's just the main thing is that they need to continue it regardless, and not be worried about, will they have a hypo if they're not really eating but still on their normal insulin. The lipodystrophy point is correct, so you should be rotating injection sites. But in terms of this situation, I think it's more important to flag that you don't want them to go into a DKA. Then the other ones, HbA1c should be checked 3 monthly, which I'm sure you probably know. Podiatry is also an important thing, but I think it's a yearly thing. It's not a once a month thing. And there's nowhere that suggests that diabetics can't have sugary foods. Obviously, they do need to be cautious with diet, but it's not something that flat out needs to be avoided. So, next question. An 18-year-old girl has been referred to the dermatologist with severe facial acne and areas of scarring. She's tried topical benzoyl peroxide and limecycline. Her past medical history includes depression, drug history. She's on the combined oral contraceptive pill, and she takes sertraline. Social history, she doesn't smoke and just drinks alcohol socially. And the dermatologist prescribes isotretinoin. What is the most important piece of information to give her? Okay, so most of you got this correct. So the answer is she must have pregnancy tests every month whilst on treatment. So the key point here is that isotretinoin is teratogenic, so any woman of childbearing age or potential needs to be using really effective contraception for a month before, throughout, and a month afterwards. And then with this comes needing to do a pregnancy test. And I think there's also a point when you're getting the prescription that you actually have to show a negative pregnancy test before collecting the prescription. So it also does affect mood, anxiety, and suicidal ideas, but there's no need for a formal psychiatric review. And her GP is also managing her depression. Headaches are a common side effect, but this is not as important as stressing the point of teratogenicity, and she can't breastfeed whilst on this medication. And so use of condoms are actually not a sufficient use of contraception. So in the BNF, there's a section which explains what counts as sufficient contraception. And for isotretinoin, it counts as one, user independent, so something like the IUD, or two, user dependent means, for example, the pill as well as condoms. So this is just the section of BNF which you can find this information in. Okay, I'm going to hand back to Helena.
Okay, now we're going to have a couple cases in psychiatry. So first, 34-year-old man by his psychiatrist. What is the most important item of information from these he should be aware of? I'll give 10 more seconds. Okay, so the correct answer is C. Maintain good fluid intake and avoid drastic changes to salt and diet. So we can go, if we go to the BNF, lithium is a salt. So changes to fluid balance or other salts in the body can change his therapeutic. So whether it's therapeutic or not, and it's very easy, it's a very narrow therapeutic margin for lithium. So the other answers, if you go to the next slide, Nidhi, I've put a little table here with the different antipsychotics and mood stabilizers that are prescribed in psych and the different kind of the main side effects or things to be aware of for each. So for all antipsychotics, they're all increase plus photosensitivity. So we'd advise for sun cream, but that's not kind of a very acute issue. Lithium, because it's a salt, it's the water intake and other salt intake. Clozapine, there's a high risk of agranulocytosis. So that would have been answer B. That would have been for clozapine. Report to GP for any signs of infection or flu-like illness. And sodium valproate is teratogenic again. Great. So next question. Oh, it's just one. Obs and gynae.
Okay. So, case 11, a 60-year-old lady has just gone through menopause and is feeling hot flushes, body aches, mood swings, and occasional sweats at night. Past medical history is non-significant and her BMI is 25. She doesn't smoke. She's agreed to start a combined estrogen and progesterone pill. What would be the most important to tell her regarding her risk of breast cancer? Give you 10 more seconds. Okay, so the correct answer is actually E. So in the BNF, under the sex hormone section, it discusses the risk of breast cancer. So all types of HRT increase the risk of breast cancer after 1 year of use, not 1 week of use. And it is true the excess risk of breast cancer persists for more than 10 years after stopping HRT when you compare it to a woman who's never used HRT before. I think the vaginal and topical preparations don't have that increased risk of breast cancer, and it doesn't just affect women over 65, it also affects women under 65. And the risk of breast cancer is actually increased for combined preparations rather than estrogen only. I don't know whether it's probably to do with estrogen being more likely to cause endometrial cancer, but for breast cancer, there's a higher risk when you have combined estrogen and progesterone. So yeah, that's just a summary. And then the next question is 24-year-old lady presents to the GP to discuss her new pregnancy. So her past medical history includes sickle cell disease and eczema. She's on cocodamol when she has an acute crisis. The GP confirms there is a viable pregnancy in utero and discusses her taking folic acid. So what's the most important piece of information that should be given to this patient about folic acid? Okay, so the correct answer is D. So she should take 5 milligrams of folic acid. She should take 5 milligrams of folic acid daily throughout the whole pregnancy. So this is another one of those that is directly answered in the BNF. So there's a section. Sorry, just go back a second. Don't know why it's not letting me go back. essentially there's in the BNF there's a slide which summarises what kind of pregnancy there is. So if there's a pregnancy which is a higher risk of neural tube defects, then it will tell you to take the 5 milligrams of folic acid until week 12, whereas a pregnancy that's not at high risk of neural tube defects will be the standard 400 micrograms. But there's a section for patients who have sickle cell, and that basically says you need to take the 5 milligrams of folic acid every day until week 12 of the pregnancy, until the pregnancy is completed. The side effects do include things like flatulence and nausea, but these aren't as crucial to talk about compared to the fact that she needs to take folic acid throughout in comparison to a pregnancy that's not sickle cell or not high risk for neural tube defects. Also, there are dietary things you can do to increase folic acid, but these are not sufficient for a pregnancy and won't account for the amount that you need to be having. So yeah, I'll hand back to Helena for the GP.
I'm just waiting for the slide to load. Can you see the GP slide, Nidhi? Yeah, or what slide are you seeing?
I can see the case 13. Can you?
No, I'm still on risk of breast cancer BNF slide.
Oh, what?
I think it's just a bit slow on my computer.
Zona, can you see it?
Yeah, I can see 13. If one of you wants to, if you can see it, Nidhi, if you want to.
Do you want me to just do it? Okay. So a 68-year-old man presents to his GP asking for help to stop smoking. His GP prescribes him a nicotine replacement patch. So past medical history includes ischemic heart disease, type 2 diabetes, and depression. What is the most important information that should be provided to this patient? I'll give you a minute. Okay, so the correct answer for this is actually E. So I think that, yeah, this section of the BNF, you'll be able to find some of the important information about the nicotine patches. I think some of the other ones also might be correct, but it's not as important as warning about blood glucose monitoring. Yeah. Sorry, I don't know if there's anything else you wanted to add to that one, Helena,
I'm still stuck on the breast cancer slide. I might try leaving and rejoining. Can I do that, Sona? Or will it let me rejoin?
Yeah, you should be able to rejoin.
Okay.
And then just in the meantime, I just wanted to just highlight to everybody for the miss pill rules. If you're not already aware, I'm sure you are, but there's different rules for the combined and the progesterone only, and within the progesterone only. So, for example, Cerazette has a different rule for missed doses than the other progesterone only pills. So just have a read in the BNF surrounding that, because you could get kind of a bit flustered or caught out in the exam if you're asked. And also there's information about what to do if you have vomiting and diarrhea. And it's whether it's been more than 2 or 3 hours, whether you take a new pill or you seek emergency contraception, things like that. have a look in the section, because it can get a little bit confusing. And in there is a section, there is a treatment summary, but it directs you to NICE guidance and things like that, which you obviously won't have access to in the exam. So to find out the missed pill rules and what to do in diarrhea and vomiting, you need to go into each drug monograph and have a look there for the guidance. So if it's microgynon 30, go into microgynon 30 and have a look at the drug monograph, and all the missed pill rules and stuff will be there.
Thank you, Sona. Okay, so that basically completes the providing information session. Thank you so much for joining. What have we missed? For some reason, it won't let me go back, so let me try re-upload. No. Which slide was it that you're referring to?
If you press the back button, does it work rather than the back button on your keyboard? No. Interesting.
I don't know why it only lets you go forward. Which is also annoying because the QR code was on the slide that's just gone.
That's fine. I'll put, guys, in the meantime, while we try and do that, I've put the feedback in the group chat. Is it working?
Yes, I think so.
It might just be a slow.
Yeah.
Yeah, it's going back now.
Yeah, which one was it that we missed?
Keep going back. I think it was Helena's one, wasn't it?
The nicotine one.
Yeah.
Yeah, for this one, so they're all side effects of nicotine replacement, but the one that's most important is glucose monitoring. So if we go to the BNF section of nicotine, you can see it lists them, but in general cautions, it specifies about the blood glucose that needs to be monitored, especially if the patient is diabetic.
And the folic acid one, please.
Yeah, I'll just go back to the folic acid one. So yeah, basically it's all within the BNF. It's literally on the top section where it tells you what dose to give for what indication. So 5 milligrams of folic acid daily throughout pregnancy for everyone who has a sickle cell disease. 400 micrograms is the standard dose if they don't have any neural tube defects, or a low risk of neural tube defects, I should say. And then if they're high risk of neural tube defects, then it needs to be 5 milligrams for 12 weeks. And then, yeah, the rest of it, side effects and dietary, is obviously not as important to talk about. I hope that helps. So thank you all for joining. The next session is session 8, which will be on the 5th of January next year. So it'll be Obs and Gynae, GP and Psychiatry. And then there'll be another session after that. I think there's just a couple more before the series is finished. So if you wouldn't mind filling out the feedback form, it will be really helpful for us in terms of things that we have to log in our feedback, but also just for the Mind the Bleep in general, so we can make improvements. And you can email that email if you have any questions, or if there's anything you want to discuss.